Hi everyone, welcome to MD-VOD, your health live and on demand, here on emPOWERme.tv. I'm Dr. John Kennedy, and today we're taking a look at breast cancer, which is the most common type of cancer found in women in the United States. In fact, if you're female, you have a 1 in 8 chance of developing breast cancer in your lifetime. Fortunately, most breast lumps aren't actually cancer, but instead related to changes in hormone levels over your menstrual cycle. And although breast cancer is the second leading cause of cancer in women, earlier detection and improved treatment are helping to decrease mortality rates from the disease. Part of the reason has been emphasis on breast cancer self-exams, which are a great way to become familiar with their body and help notice any early changes. This week, we'll be joined by breast cancer expert Dr. Granzow, who will help us prepare to talk to your own doctor about what breast cancer is, who's at risk, and common symptoms. Dr. Granzow will also help us understand the diagnosis and about treatments and therapies that are available. Finally, we'll talk about whether insurance providers address some of the costs. When we come back, we'll take a look at the anatomy of breast cancer to help us have a thorough understanding of this disease. Hi everyone, welcome back to MD-VOD, where today we're talking about breast cancer. And in order to understand any disease, it's really important to know your anatomy. The breast has a number of different anatomic structures. The outer, or areola, the nipple, the ducts, the lobules, the subcutaneous fat tissue, and there's also important structures beneath the breast tissue, the muscle, which is the pectoralis muscle, the intercostal muscles, and the ribs. And then when we look at the outside of the breast, we also notice in this diagram this greenish tissue, which represents the lymphatic tissue. The lymphatic tissue is important for bringing waste products away from the breast and also for bringing immune cells like white blood cells to the breast. It's also important because that's typically how breast cancer tends to spread is through the lymphatic tissue. The breast is also divided into 4 different quadrants. The upper inner quadrant, the inner lower quadrant, the outer lower quadrant, and the upper outer quadrant. It's important to know that because breast cancers occur in all of them. The most common occurs in the upper outer quadrant, and the most common cancer occurs in the ducts. It's known as invasive ductal carcinoma. So that's the anatomy. Join us next when we're here with breast cancer expert Dr. Granzow to tell us all we need to know about breast cancer. We're back with Dr. Granzow, breast cancer expert and board certified plastic surgeon. Dr. Granzow, thanks so much for joining us.
Hi John, thank you for having me.
So what exactly is breast cancer?
Breast cancer, like other cancers, is a group of cells that are growing out of control in the body. In this case, they start in the breast and they can go other places.
Okay, that's what it is. And can lifestyle factors like obesity, what we eat, can those things affect whether we get breast cancer?
Well, obesity is a risk factor. What you eat, it's how much you eat, and your weight has been shown to increase the breast cancer risk that you have over your lifetime. So it's a controllable thing. Decrease the weight, you'll reduce your risk of breast cancer.
And who is most at risk? Like, can you get it if you have a family history, or is there any inherited risk factors for breast cancer?
Sure. Like we talked before, breast cancer is a very common cancer in women. 1 in 8 women over their lifetime will get a breast cancer. Now, women are more common or more likely to get breast cancer if you have a first-degree relative, such as a sister, a daughter, or a mother with breast cancer. If there's a history of cancers in your family, such as colon cancers, pancreas cancers, thyroid cancers in men or women, that will increase your risk as well. Otherwise, certain family histories, such as if you're Ashkenazi Jewish, will also have a risk of higher risk of breast cancer. There's a small segment of breast cancer, less than 10%, that are actually due to known gene mutations. When you talk to your doctor, you can ask them about this gene mutation and whether you're at risk for this problem.
That's great advice. And is a lump in the breast, is that always the first sign of breast cancer?
It's often the first sign, and a lump is something that's very important to pick up, whether it's you or your doctor. We'll talk later about self-examination, which is critical in assessing breast cancer risk, but other changes in your breast too will be important to look at. If there's a change in skin color, shape of your breast, if the nipple is changed, or if there's a different discharge from the nipple, those issues or problems can signal breast cancer, and you should talk to your doctor about those. Now, most of these changes still don't result from breast cancer, but it's better to have it looked at earlier than later.
Wow, that's great advice. Breast self-exam, which we'll talk about later, is really important. Once we have a suspicion that it's breast cancer, Dr. Granzow, how do we diagnose breast cancer?
Breast cancer is most diagnosed on physical exam. Okay. So whether it's your doctor or you finding it, a lump in the breast is quite suspicious. Now, there are other studies, usually imaging studies, that can be added as well. A mammogram, which is a specialized X-ray looking at the breast, is very important. Other imaging modalities such as ultrasound or even MRI scans can be used and called for by your doctor when necessary.
And you said it, you know, the physical exam in history is the most important thing, and breast self-exam, we can't emphasize it enough. How can we teach, you know, people how to do the self-breast exam? Is there any particular way that we can teach people that'll help them diagnose it?
What's important is to be consistent and to do it regularly. Know your body. Every week, pick a time, whether it's Saturday, Sunday morning, in the shower, that you can do your breast exam and don't miss it. Look at your breast, feel your breast, start at the top, work your way around like on a clock face, all the way around, and don't miss any portions. Even the center under the nipple and up into the armpit. Any changes that come up, review them with your doctor.
And it's also, that's great advice. And remember, routine and doing it. You got to do a self-exam in order to notice changes, and that's when you can really, you know, get involved early and be referred to doctors like Dr. Granzow, so that you have the best possible outcome. Once it's diagnosed, Dr. Granzow, what are some of the most common types of therapies available for breast cancer?
Sure. Like most cancers, breast cancer is treated in three main ways. First is surgery, meaning take that tumor, get it out. Second is radiation therapy, which are special X-ray beams designed to treat the cancer. And chemotherapy, which is medications given to treat the cancer as well. When you have surgery, you usually want to plan to have some sort of reconstruction as well.
So there's, and is there ever a time when radiation might be helpful for breast cancer?
Radiation is often helpful, especially if you have a treatment modality called a lumpectomy. It's a limited type of surgery that allows you as an advantage to save some of your breast. Now, the drawback is that you have to add something like radiation therapy afterwards, but again, very helpful, very useful. Your doctor will help you decide when it's the right time for radiation therapy.
That's great advice. And you've brought an example of one of your patients here today that you've treated with breast cancer. Can you take us through an example of what we're seeing here?
Sure. This is a great patient. So this is how a patient might come in before or after their cancer diagnosis, but before they've had surgical treatment and mastectomy. Now, when we have our after picture, this is how they can look after mastectomy and reconstruction. Here, I did a reconstruction using the patient's own belly or tummy tuck fat, replaced the breast and repaired that, and also did a cosmetic procedure on the opposite side. We're taking the cancer diagnosis, taking that procedure, and turning it into an aesthetic operation at the end of the day.
Wow, that's incredible. So it's therapeutic, meaning you treat the cancer, and it's also cosmetic. That's an incredible result. So in addition to chemotherapy, inappropriate patients, and surgical treatment like you're showing here, Are there any new therapies that are available that you see coming down the pike for patients with breast cancer?
Sure, medical knowledge progresses and increases all the time. Surgery is progressing. For example, more recently, we know that we can sample lymph nodes instead of take them all out of the armpit as part of the treatment. That can reduce your risk of having arm swelling or lymphedema, for example, after your surgery. Radiation therapy, both the equipment and the scheduling of the treatment are improving, and new chemotherapy medications are coming out all the time. Even medications that you can take as pills, for example, instead of requiring an IV, with less side effects than we once previously had.
So that's great stuff. So there's new stuff all the time. Make sure we stay informed, like we always say, at MD-VOD at cdc.gov. My other question is, all this treatment and diagnosis, it can be really expensive. How can we decrease the cost of this disease?
Early detection is key. Make sure you do your self-breast exam every week. Follow up with your doctor. There's a schedule, and typically women age 40 and older should have a mammogram once a year. Follow the recommendations of your doctor, especially if you have a family history or have family members with cancer. The earlier you get it, the less treatment usually is required and the less expensive it will be.
Wow, that's great advice. So early detection, those self-exams are really important. That's great advice about saving on the cost. The American Cancer Society and some pharmaceutical companies have programs that can help people that can't afford some of the care required for breast cancer. How does this work?
What you do is, Internet is a great resource. Talk to these organizations. If your insurance doesn't cover well, let me back up. Federal law requires treatment for many of the breast cancers and also the reconstructive part, so the plastic surgery part afterwards. Within this legislative framework, the insurance companies have patient advocates to whom you can turn. American Cancer Society, National Cancer Institute are also good sources of information to help get your bills covered if this does come up.
Wow, that's such great advice. I want to thank you so much for summarizing such an important disease. You talked about the treatments, the diagnosis, the ways to prevent it. Please, join us next on An Apple a Day when we talk about ways that you can prevent breast cancer, and also stay tuned because Dr. Granzow will be here to answer your questions live on Facebook and Twitter. Jay, thank you so much for joining us. That was incredible information. We're back with An Apple a Day and some common sense tips to help minimize the risk of breast cancer. Being overweight can actually increase your risk of breast cancer. So get up and move, because we know that moderate daily exercise reduces breast cancer risk by 15 to 25%. Also, make sure to eat plenty of fruits and vegetables because it can lower your risk of breast cancer, and an unhealthy, high in saturated fat diet can actually increase your risk. And if you're over 60 or have risk factors for breast cancer, make sure you have a discussion with your doctor about medications that could actually decrease your risk. And if you can, get involved in participating in clinical trials that study ways to reduce the risk of breast cancer. Just some examples include research looking at whether soy, vitamin D, or green tea and other supplements can actually lower your risk of breast cancer. So join in and find out about breast cancer awareness in your area. Wear a pink ribbon or attend a fashion show. Organizations that support breast cancer research host hundreds of events every year to raise money for research efforts. And be sure to stay on top of the latest news about breast cancer research at cdc.gov, because the more knowledgeable you are, the healthier you will be. Thank you very much for joining us, and I hope you found this information about breast cancer helpful. And don't forget to have your list of questions that you learned here with your doctor, because remember, this information is always available to you on your phone in case you forget something. I'm Dr. John Kennedy, and you're watching MD-VOD, your health live and on demand, here on emPOWERme.tv. And don't forget to like us on Facebook, follow us on Twitter, and share us with your family and friends. And for any episode you might have missed, they're now available on emPOWERme.tv's website and the YouTube channel. And also remember to leave us your comments and questions so that we can better help you understand your condition. We'll see you next time on MD-VOD.